Hi, I'm Ashley Simons-Rudolph with the Pacific Institute for Research and Evaluation. I'm here today to talk with you about building capacity and collaboration to identify and respond to IPV and HIV-related risk within community-based organizations. I worked on this project with some great colleagues, including two of the co-authors that are you see down below, April Schweinhart and Olivia Silver-Ashley. Okay. So we know that IPV occurs across the gender spectrum, but that the majority of IPV survivors are women. We also know that COVID-19 increased the incidence of IPV about 6%, at least 6%. And we know that interrelated is IPV, HIV, and the misuse of substances. So in the early days of the pandemic, um, we know that IPV is increasing. And so I want to talk with you today about a particular context in the state of Kentucky in the United States. In the state of Kentucky, the Governor Beshear took proactive measures and announced a series of restrictions and recommendations to help mitigate the spread of COVID-19, including closing down lots of businesses, schools, universities, and some community-based organizations. So, closing down some community-based organizations and reducing capacity of others. What happens to that when the community need for IPV services is increasing and the services are decreasing? Well, we know that there were fewer calls for service, at least at the Louisville Metro Police Department. You can see that in the slide below. But the calls that did come in and where they responded, there was an increased lethality, right? So increase of IPV, decrease of community-based services, decrease in police reporting, but increased lethality for the reports that were made. So we really need our community-based organizations to provide services here. But we know from some of the formative work that we have done on this project and elsewhere that community-based organizations often they'll address issues separately, right? And so they'll have an organizational mission and a focus on one particular aspect of health, and they want to serve clients holistically, but they don't always know how to do so. Sometimes there's organizational barriers. Sometimes they feel like it's, they're not really sure where to refer clients. And so one part of this project was to connect an HIV serving organization to an IPV serving organization for mutual benefit. So we had talked about this and strategies of partnering and how to decrease silos and really integrate work for different community-based organizations in our 2021 In Women's presentation, where we highlighted collaborative action planning. But now that this project has concluded, we're here today to present some publicly accessible training tools that we developed that will help build capacity and in addressing intersectional issues. And these are they. So I will also put these in the chat when we have the Q&A session. But you see that we have developed training materials for people working within IPV settings and then also within HIV settings about how to collaborate about those issues specifically. However, we think that the training materials, there's a lot of overlap, just how folks in community-based organizations can work together. And so there's a lot of overlap there, and we think that these materials might be helpful for people working across social issues. Again, these are free and are available at the tiny URLs you see. And I'll give you an example of a couple things that we learned through the process and that we developed. So for IPV serving organizations, we worked with them and then also worked with HIV serving organizations to develop a checklist for HIV risk reduction, sexual planning, and safety planning. So what we learned in our formative work is that sometimes sex is hard to talk about, and sometimes there's a perception that clients will feel offended or won't want to talk about sexual safety planning, even in the context of IPV. And so just developing this tool really helped providers kind of think through the ways in which that they could address this important aspect of IPV safety planning. Now, for the HIV serving organizations, we taught them to screen, to do a quick screener, and to refer folks that had IPV-related issues, current IPV issues, to the IPV organization. So what we learned in the process is that staff really care and are making a difference. Everyone at the HIV serving organization wanted to attend the training, and everyone that came out of the training was very, complimentary of it. 87.5% of folks that went to the training actually came for second voluntary sessions where they practiced their new skills, and all of them felt more confident in referring clients at risk for IPV after having a chance to practice it. They also said that they're more willing to talk with their colleagues about IPV-related issues and also talk about these issues with their friends and in their communities. We also found that HIV serving staff were, as compared to baseline, had fewer, there was fewer myths. They were able to differentiate between common myths in the community and also, some of the facts about IPV as well. They felt moderately or well prepared to discuss disclosures of abuse after the training. So things like using supportive statements and active listening, and empathizing with clients and helping them connect with other service providers. So what we heard was that it not only did they feel more confident with handling IPV disclosure, but that the training actually improved their practice when talking with clients about other issues, which are sometimes stigmatized in our community. So here's some of the barriers we ran across, and you likely have seen things like this or heard things like this in your work. The idea that clients, who are coming for one service, like getting HIV testing, don't want to talk about IPV, or that, talking about issues is outside of their role, or that they don't have enough time within the appointment. We also heard that despite our formative work that suggested otherwise, that some folks felt that their organization already had adequate resources for women that were experiencing IPV. And so these are some of the things that we would want to consider in future work as well, is like, how do we incorporate that in the training and try to and try to address some of these barriers that folks have to getting the training. And finally, we'll just acknowledge our funder. We'd like to thank the Office on Women's Health. This was a wonderful project to work on, and we appreciate the opportunity to talk with you about it today.